Hi, I'm Dana Kraus, and the skill I'm going to show you today is sterile gloving. So you get your package of sterile gloves, make sure that they fit your hand, and if you're going to open them on a sterile field like this, you would take it and just pop it out, kind of put your body away from the sterile field so you're not leaning over it. Now take it and pop it out like that. But we're just going to open it, so this field really isn't sterile. So we're going to take this, open it up from the outside, and you do not want to touch the inside here because that would contaminate it. So just only touch the edges, and then with your first glove you only want to pick it up on the underside. See how it's folded up like this? You only want to pick it up on this side. Then you take your hand and slide it into the glove, only touching the underside. The second one, now you're going to go under the cuff like this. Okay, you can only touch this side and not this side because you're getting ready to put this hand in. So you touch it like that, put your hand in, and you can only touch it on the upper side. Now keep your hands up and out of the way, and you're ready to go. So that's sterile gloving. Okay, now I'm going to show you how to take your stuff off, your dressing, and confine it in a little small trash bag area in your gloves. So let's pretend all this is just a bunch of trash, bloody drainage or whatever, and we're going to put it all together in a little pile. Put it in your glove like this, pull your glove over it, and then take this glove and put it in this hand and pull that over there. Now it's confined, and you can throw it in the trash can. Today I'm going to show you how to teach a patient crutch walking. It's very important that they have the right size crutches and know how to do it. So you're going to position your crutches under the arms. They need to be about 2 to 3 inches under each arm. And since a patient is usually pretty sick, they can't take really big steps. So you want the crutches to be outside of the feet about 4 inches and in front of the feet about 6 inches. And the first one I'm going to show you is the swing gait, and this is for a person with limited movement or partial paralysis, and it's basically what it says, a swing gait. You put your crutches forward and you swing through. So that's the swing gait. Okay, the second one is called the two-point gait. And this would be for an elderly person or someone who needs an extra wide stance at the bottom. So 2-point you can remember because you have 2 points going forward at the same time. So you have the opposite foot and the opposite crutch, and then the other one, and the other one. And this is your 2-point gait. Okay, the next gait I'm going to teach you is called the 3-point gait. And this is for someone with a sprained ankle or broken ankle. And 3 points because you have 3 points down, your 2 crutches and your 1 foot, and the other one is up. And you just always go forward with your crutches first and then swing through with your foot. So it's a little like the swing gait, only a little bit different. So that's your 3-point gait. Okay, your 4-point gait is a little bit harder, but this is usually for someone who's been in an accident and is relearning to walk, and they need a lot of extra assistance, so the crutches work as 2 extra pair of feet. It's 4 distinct steps. You start with a crutch, then you do your opposite foot, then a crutch, then your foot. So it looks like this: crutch, foot, crutch, foot, and so on. Okay, the last thing is you do need to tell your patients, not that they plan on falling, but how to fall in case this happens. And you need to tell them to throw their crutches out to each side, and hopefully they won't land on them, and to bend their arms so they don't have their arms straight out and they don't fracture their elbows or their arms. Okay, I'm going to show you some injection sites so that you will know the exact place to put your needle in so you don't hurt the patient, you don't hit a nerve, and the patient's comfortable also. The first one we're going to do is your deltoid muscle, and to find that you find your acromial process, It's on your shoulder. You follow it down to your acromial notch, which is over the edge of the shoulder, and you go down about 3 to 4 fingers right there, and there's a space that you put it in. See this mannequin? It has the exact space right here. So it's a little bit of an average, but that's going to put you in the right space to where you don't hit anything. Okay, to find your vastus lateralis, which is on your leg, you're going to find your patient's greater trochanter, which is located right here. On yourself, you can find it by feeling your own leg, lifting your leg up, and right where it bends, it's that bone right there where it bends. And you can feel it on your patient, and then you're going to take your hand, put it below the greater trochanter, put the other hand above the patella or the knee. You're going to put your thumbs together on, I call it the imaginary gene line because that's where the lines of your blue genes usually run, right down the edge of your leg. So it makes a little window with your fingers pointing anterior or towards the groin, and then you would give your injection 1 1/2 inch up, and that would be the correct spot, which it shows here on this mannequin right here that you would be giving it about right there. So that's where you would give it for your vastus lateralis. Okay, I'm going to show you where the ventral gluteal site is on a patient to give an injection. First of all, you would find the greater trochanter by having them bend their leg up, and you see that it's right there at the bend. You put the leg down, you put your palm over it, you point your index finger to their hip, which is right up here, and you make a V with your fingers, and you give it, put that up a little bit more, you give it right there in the middle of the V, and you can see right here on the mannequin how it is. So you're not hitting bone up here, you're not hitting bone down here, you're hitting this squishy part in the middle here, and this is a really good place for absorption. So if you get that right, you've given a good injection. Your thumb is pointed towards the groin, your index finger towards the ASIS or your hip bone, your palm is over your greater trochanter, and you give it between the V. Okay, I'm going to show you the dorsal gluteal injection site. And let me show you right here what you're trying to avoid. You're trying to avoid this big nerve right here, which is the sciatic nerve, because you don't want to hit it, puncture it, and possibly paralyze your patient. So that's a real good reason why you're trying to learn these landmarks. So for your dorsal gluteal, you are going to find your greater trochanter right at the bend of the leg and right where it connects right here, and you're going to follow up the iliac crest all the way up next to the spine to the PSIS, which is called the posterior superior iliac spine. It's posterior because it's on the back, it's superior because it's up, it follows the iliac crest, and it's next to the spine, so it's PSIS, posterior superior iliac spine. It's located about 1/4 of an inch from the spine. Now you have that landmark, you have this landmark. You're going to make a line, a straight line from one to the other, and just note to self an imaginary line. You don't want to be doing this on the back of your patient. Imaginary line, go up the line halfway, and then 1/2 inch up, and that's where you give your injection. And let me show you on this. If you do that, if you divide it into 4 quadrants right here, you're giving it in the upper outer quadrant, and that's the only area that the sciatic nerve does not run, so you're not going to hit it if you give it in the upper outer quadrant. And that gives you the precise measurements for that. And that's your dorsal gluteal, and you can remember it because dorsal's on the back, like the dorsal fin of a shark. It's like the back fin of a shark. Okay, I'm going to show you how to tie a restraint. You don't want to tie it to the bed rail. You want to tie it to the bed frame. So you would put it like this, wrap it through one time, all the way through, tie it, and then the next time just loop it halfway through. And the way that you can tell that it's wrapped, that it's going to work, is if you pull on it this direction, it should be firm, and if you pull on it this direction, it should release pretty easy. So that's how you